Functional range conditioning, knee CARs, controlled articular rotations. We do knee CARs daily to maintain the health, mobility, and longevity of the knee joint. What most people know about their knee joint already is that it bends and it straightens. It flexes and extends. It's fairly easy to see that, and most people already understand that about the knee. What many people don't know about their knee joint is that it is a rotating joint also. So let's first talk about the two rotations that the knee joint does. I'll lift my foot up off the ground like this, and I'll have you do the same shortly. We're going to reference rotation from the midline of the shin. So if you take your fingers and you rub them down the middle of the shin, you're going to find a ridge of bone. That's called the tibia bone there. This is going to be our midline to understand the two rotations. The first rotation of the knee is going to be external rotation, where I'm rotating and twisting that shin bone and knee joint out away from the midline of the body. That is external rotation. There is also internal rotation, twisting this shin bone and knee towards the midline of the body. So external rotation, internal rotation. This can be done sitting in a chair. It can also be done on the ground like I am here. What I'd like you to do is grasp on the sides of your shin and start to find your end range of motion as you twist and rotate the knee into external rotation and internal rotation. You can find that the hands will help guide these two ranges as you go inward and outward. Then take your hands away and try to do that actively without using the hands. And what we're going to use is this internal and external rotation going through flexion and extension, or straightening and bending of the knee. So I'm going to take this arm, I'm going to place it back behind my thigh on the underside of my leg. And take this hand and grasp around the other such that I can lift this leg up off the ground. So now my foot is all the way off the ground. We're going to start the knee CAR with external rotation of the shin bone. I should mention, when we go into internal rotation, we want to avoid the foot rolling in that way. We want to keep that foot up so that it is only the knee joint rotating, not the ankle diving under like that. Similarly, don't let your thigh bone rotate off the midline so that we pour this rotation only into the ecosystem of the knee joint. So, I've got my arm clasped behind here, my hands together, and I will begin with external rotation. Once I'm at my end range here, I'm going to extend my leg and knee as far as I can this way, and then transition into internal rotation, where I then pull back down into bending or knee flexion. External rotation, kicking up. Internal rotation, pulling down. Twisting out, extending, rotating in, flexing. So that as we're going through this rotation, we're trying to find our end range of motion as it goes through the bending and straightening. We can reverse directions by going into internal rotation and extension, external rotation and flexion. Internal rotation with straightening, external rotation with bending. You can go one way or the other, but the goal is to work it through those rotations as you flex and extend the knee joint like that. So that's our functional range conditioning knee CARs, controlled articular rotations. Do your knee CARs daily to maintain the health, mobility, and longevity of your knee joints.